Amy and Martin.
Mhm.
I'll hand over to the both of you, and we'll take it away. And thanks so much for coming to join us this Tuesday evening. Thank you.
Thanks so much, Isaac, for having us. Well, actually, there are two health ambassadors in this meeting. We've got Martin, but also we've got Duncan,
Absolutely.
who is our learning disability health ambassador. So we've got Martin here asking questions for Autism Awareness Week, but Duncan will be doing some of his own presentations just a little bit in the future as well. So I thought it'd be good for Duncan and Martin to introduce themselves to the group. So Duncan and Martin, I'm going to have you say your name, what borough you represent, and why you wanted to be a health ambassador. And then we can start talking about what health ambassadors do, and then we can start answering and asking questions. So Martin, do you want to start?
Of course. Hi everyone, my name's Martin. I'm from the borough of Bromley, which is what I represent as a health ambassador. The reason I wanted to do this job was effectively I wanted to work take on a new challenge in this field of working, and I just wanted to try and help out fellow folks with learning disabilities and autism, and see if I could help in any way, shape or form to make their lives better.
Excellent. Thanks so much, Martin. So Martin is our autism ambassador, and he covers the boroughs of Bexley, Bromley and Greenwich. So Duncan, can I ask you to do the same thing? So your name, what borough you represent, and why you wanted to be a health ambassador.
I'm Duncan. I cover Bexley and Bromley. That's why I decided to become a health ambassador, was to speak up for people with a learning disability and to help health professionals like doctors, nurses, opticians, that people who you might be in touch with today, so that to make your life better and easier.
Right, and what I think Duncan has done is he's led me in perfectly to what I was going to say. So we're from a new project called Health Ambassadors. So we're working with the NHS, and what we're doing two things. So one of them is we're working with the NHS. So like Duncan said, doctors, nurses, opticians, dentists, and we're making sure that they understand how to take care of you in the best way possible. So that includes making information easy for you to understand, but also making sure that your rights to health are being followed. And the second thing we're going to do is we're going to make sure that you guys are as healthy as you can be. We're going to make sure that you know about your vaccinations, your cancer screenings, your annual health checks. So that's what we're going to be doing throughout the year. So we're going to be chatting to you.
I had 2 jabs on the arm. And for vaccination
Yes.
thing.
Yeah.
I don't know if we have a third one or not. I don't know. I'm just asking that question.
I think at this stage, don't worry about it for the time being. Wait until we hear what the government are going to say.
Yeah.
So no need to worry about it for the time being. Or maybe if you've got any questions, then speak to your support worker, whoever, say your family, or maybe go to your doctor's surgery.
Yeah.
If you feel comfortable.
Okay, guys. So the first question we're looking to ask is, what do you need from health services?
What we need from health services is for them to have appointment letters in different sizes for people who are like visually impaired.
That's a really good one, Adam.
With the people like me who have got eyesight trouble.
Mm-hmm.
You know, when you ring up the doctors, they take very long to call up, and you have to wait on the phone, and it takes ages, and I think you're just sitting there and think, oh my God, how long are they going to pick up the phone?
I mean, for me, I found two difficult things. Website doesn't make any sense at all because there's too many words that I don't understand. Number two, when you're trying to make an appointment or for like a doctor advice, they speak to you so quick and you don't understand them. So for me, I have to ask them, can you explain to me slowly? But they still don't understand that. And the other thing that I noticed, you know, when you walk into the GP receptionist, the second was the same thing. The receptionist talked to me, but again, they speak too fast, and I try my best to say, look, I've got a learning difficulty. Can you please explain to me slowly? But sometimes I understand them, sometimes I don't, and that's a little bit annoying. You know what I mean?
I agree with what you just said. They do sometimes. The doctor do really speak fast, and I asked them to slow down. I do agree with you. Yeah.
Is it easy to ask them simple questions back to you to say, do you understand that particular question, and then you got to say yes or no?
Do you know what? Fair enough, Duncan. They don't actually say that. They just talk all the way, and they just want to know that if I understand. But there's so many times when I went to the GP, to the receptionist, I said the same thing, but they never changed. You know what I mean? And sometimes, you know what? Do you know what I have in my head at the minute? I'd rather the receptionist staff have a little bit of training of autism or learning difficulty, just to train and see how they talk and speak to autism or disability. That's an idea I have in my head.
Are they aware of the hidden disability? Do they understand people with a hidden disability, like, and patience and time? But are they aware that sometimes we do get flustered? Like I get flustered sometimes, if you know, and you know, it's not always easy. You know, if people talk quick, doctors, receptionists, or dentists, and you know, anything like that. You know, that's what I'm saying. Do they understand about the hidden disability? Sunflower.
When you guys have gone to the doctor or the dentist or the optician, have you ever been given easy read information from, so if you could put your hand up if you have received easy read kind of documents that give you the information about treatment?
Whenever I go to my appointment at Moorfield for my eye appointment, I have not seen any of that.
But it's also handy for able-bodied people too, as well as learning disabilities and autism.
Yeah.
So I think now's a good time for maybe Martin to ask our second question.
The second question is, what services would you like to see?
I would like to see easy read information in all the health services, whether it's GPs, dentists, opticians, hospitals, and also not just in those sorts of services, but in like in leisure centres as well.
Oh wow! So when you're going to the gym to get healthy and
Yeah,
stay healthy, you'd like to see
yeah.
some easy read information on how to keep fit.
What I like is when for people to, when they go to see their GPs, is to have for the GPs to have the easy read on their monitors to say, do you understand? If not, let them show the monitor or the computer to say, this is what I'm trying to explain.
So I know we spoke about, you know, receptionists and GPs and people on the phone speaking slower, but do you think they should also be trained to check in more often with you to make sure that you're understanding and giving you space to think?
Yes, but then that will mean making double appointments, and then raising, can I have a double appointment? So rather than have a 5-minute appointment, it'll be 10 minutes. We've got to try and remember.
What about giving the right information about appointments? That's what I was going to say. You know, what time you're coming to see the doctors and date and mum, you know, and all that.
Is it by post or by email?
Like, you know, like when if they send you, like post, like, you know, because they might send you a letter in the post, you know, like what day your appointment, your doctor, your dentist, your optician, you know, you don't know. So
it's a really good idea, because it's a lot of information that is put sometimes just on one side of A4. There's no pictures to help people to understand this is the actual time that they want you to be there. And then also what it is that they're actually wanting to actually do, whether it's a scan, whether it's we talk about medication, it should all these different things should have pictures that make it easier for people to read letters.
That's what about when if a letter is being sent to you, have it in bold so it stands out?
Well, yeah, that's one of the points of easy read, is that the words that they use should be big and clear and in a text, in a font that's really easy to read, and it should be along with pictures as well to help you understand.
For me, I like the receptionists and the doctors to speak clearly and slowly, and the same thing as you say about the letters, like less writing and probably some pictures, like clear pictures, so like that I understand too. So yeah, it's exactly the same. It's exactly the same. Like what you just said earlier. Do you know what I mean? So yeah, that's the one.
I agree.
Now, when you go to the doctors, I'm not saying they're all not sympathetic, but they use, you know, if you've got something wrong with you, you come out, obviously you're going in because you're poorly and everything, but sometimes they use very, very posh words, like, you know, that jargon, you know, and sometimes they're posh words. I'm not being funny, the jargon, I don't always understand. Do you know what I mean? So probably not so much all these big fancy words as my dad would say, you know, just keep it nice and simple.
When it comes down to medicine, there's got to be easy read for the main type of tablet that you may or may not be taking. So if the tablet is in doctor's terms, we may not be able to understand it. So we've got to try and put that forward to the GPs or the health services.
I say that includes pharmacies as well.
Pharmacies as well.
Really helpful if pharmacies had easy read information on your medicine Yeah, that's a really good suggestion, because I actually hadn't thought of that, and
Yeah, that
that's
is
such a
good.
big part about you being independent is taking care of your own health.
Yeah, the only thing is the doctors, the receptionists, and the nurses, they don't know you got disability or autism. You got to tell them that. Yeah, that's the only issue. They don't. That person might not know you got disability or autism. You just have to tell them.
My name's George, by the way. I believe that what you need is someone that's willing to listen to you. Someone that will take time to understand what type of disability you have. Because there's many, as you know, there's many people with so many complex disabilities. Amy would vouch for that, because we work with many, don't we, Amy? You know, there's so many different, people within wheelchairs, people with cerebral palsy, and plus, I believe with someone like a dentist, my dentist is very understanding. He will listen to you. He'll take his time. He'll say, now, you let me know if it hurts or anything like that. So, but he is very good, and I think he does, because he works a lot with not only people with learning disabilities, but I think he works a lot with young kids as well, that that haven't got a very good pain threshold. So all right, some of them got their mums with them, to hold their hands, but it's he's very good like that, my dentist, and I think so is my optician. He's very, she's very good. She'll listen to what you want to say, and she'll take her time and realise that some people can keep their eyes open longer than others, and so it's but I think a lot of the health professionals are getting there. It's just taking them a long time to realise that they're working with people with a lot more complex needs than others. My doctor's fairly good. She will listen to you. So will some of her locums, but it's I have been to some doctors. You go in, tell them what's wrong, and within 5 minutes you're out. You think, well, that was quick. I know you can ask extra time. I suppose it varies depending which medical practice you're with, and whether or not they will understand you in the first place. And they understand which type of complex needs you have. I'm using all these long words again.
Have you ever been given easy read information when you saw a doctor or test?
I haven't, no. But I know it's about, because I was a couple of years ago, I was up at the hospital with Gordon, because he had to have an eye test. And I did start looking at some of the pamphlets, and I did notice that some of the pamphlets are starting to get a lot of easy read things in. And I said to myself, brilliant, that's brilliant. It was at the Peru, the Princess Royal, the eye clinic upstairs on the first floor, I believe. And I was sitting there, I was sitting in the waiting room, and I was just, Gordon had gone in, and I'd just sitting there. I thought, well, I'll have a look round. And you could see sometimes they had like their little leaflets, their little booklets. And I thought, well, I'll have a look at that. And I thought, that's brilliant. That really was brilliant that they've done it in easy read. I think it's because a lot of, not only when we done a partnership board on it, I think a lot of it was when we done what they call secret shoppers, where we went round hospitals to explain to them. There's a lot of people around that doesn't understand what you're on about.
Hospital notices, I haven't, whether or not there needs to be, the signs might need to be in easy read, maybe. Just say, for example, opticians, easy read eyes, for example, for like signs.
Maybe they have a picture of eyes next to them or something like that.
Yeah, a picture and writing. People can't put two and two together. And the other thing is, when you're admitted to hospital, I think you have to put your details on an iPad. So how easy or hard is it with people with learning disabilities or autism to put their own information on when they may need a member of staff, the next door neighbour, friends, family, whoever, before they're admitted?
What I could do is have the have it on an iPad, but like have like a voice giving you instructions on what to do.
One professional I have just thought of, ambulance people, when they come to your house.
Paramedics, yeah.
You know, do they know about people with like hidden disability, learning disability?
To a notice with people with learning difficulties and disabilities, so they know how to treat them. Because a lot of, sometimes you could, like Duncan, sometimes you could collapse in the street and you may not have any information on you. And my mum used to always carry information around with her because she was diabetic, in case she, you know, went into a hypo or anything like that, that they knew what to do. But I mean, some people probably forget to carry stuff around with them, and they if they're in, like Duncan would, if they're in a seizure, they can't explain to the, but some of the paramedics, I think now, are being trained to recognise what type of whichever the illness is, or what type of, you know, thing that's going through, you know. Yes.
I was going to say, nice meeting the two two boys, and you as well, Amy.
So this won't be the last you see of me, Martin, Duncan. Sonny's our other learning disability ambassador, and we have a lovely autism ambassador called Elizabeth. So we will be coming around to groups to have chats, to ask questions, to talk to you about cancer screenings and vaccinations.
So would there be different? Would there be the same people? Would there be the same or different people? I don't know.
So it might depend on who's available when. But you know Duncan, and
yeah, I know
I
Duncan,
think some of you guys know Sunny as well.
Yeah, we know Sunny. Yeah, definitely.
And I'll always be with the health ambassadors as well, so you'll always have a
but it was nice seeing you, Amy. Yeah,
it was really nice seeing you guys as well.